Ever wondered how doctors explore your heart without opening up your chest? The heart, a critical engine of our body, requires meticulous care. However, it can sometimes face issues, from minor hiccups to serious conditions that may require medical intervention. The importance of maintaining a healthy heart can't be overstated, as it's vital for our overall well-being. So, how do doctors diagnose and treat heart conditions without a major invasive procedure? Two procedures that help doctors diagnose and treat heart issues are angiography and angioplasty. So, what exactly is angiography? You may be wondering. Well, let's dive right in. Angiography is a medical imaging technique used to visualize the inside, or lumen, of blood vessels and organs of the body. It's like being able to see the flow of traffic in your body's highway system, specifically your circulatory system. The primary purpose of angiography is to identify any blockages or narrowing in the blood vessels, especially those leading to the heart. These blockages, often caused by plaque buildup, can restrict blood flow, leading to heart-related ailments. Here's how it works. A special dye is injected into the bloodstream, which then travels through the arteries. This dye makes the arteries visible under an X-ray, allowing doctors to spot any abnormalities. In essence, angiography is a crucial diagnostic tool, a roadmap, if you will, that helps doctors understand the condition of your heart's arteries. It's like having a GPS for navigating the complex network of your body's blood vessels. Think of angiography as a roadmap for doctors to understand the condition of your heart's arteries. Then, we have angioplasty. This is a medical procedure that is often used as a treatment method to widen blocked or narrowed blood vessels. Let's break it down a bit. The term angio means vessel and plasty means repair. So angioplasty is literally a vessel repair procedure. In the heart, where this procedure is often performed, it's all about improving blood flow. Imagine a highway with a roadblock. Traffic builds up and things get congested. Similarly, when a coronary artery gets blocked, the heart muscle doesn't receive enough oxygen-rich blood. Here's where angioplasty comes in. A thin tube called a catheter is threaded through the blood vessels until it reaches the blockage. A tiny balloon at the end of the catheter is then inflated to push the blockage aside and restore blood flow. Sometimes a small metal coil called a stent is left in place to keep the artery open. So while angiography is about identifying the problem, angioplasty is about fixing it. It's time now to compare these two procedures side by side. Angiography and angioplasty, despite sounding similar, serve distinct purposes within the realm of heart health. Angiography essentially is a diagnostic tool. It allows doctors to get a clear picture of your blood vessels, pinpointing any blockages or abnormalities that might be affecting your heart. This is done by injecting a dye into your bloodstream and capturing X-ray images. If any issues are detected, the medical team can then plan the most effective treatment strategy. On the other hand, angioplasty is a therapeutic procedure. It's typically recommended when there's a significant blockage in your arteries that's causing chest pain or increasing your risk of a heart attack. During angioplasty, a small balloon is threaded into the narrowed artery and inflated to widen it, often with a stent left behind to keep the artery open. The goal here is to improve blood flow to your heart, alleviating symptoms and reducing the risk of further issues. So while angiography is about identifying problems, angioplasty is about fixing them. They are two halves of the same coin, each playing a vital role in maintaining heart health. It's worth noting, however, that these procedures are not mutually exclusive. In many cases, angiography is performed first to identify the problem, and if necessary, it's followed by angioplasty to rectify the issue. While both procedures involve your heart's blood vessels, they serve different yet complementary roles in heart health. So, there you have it. Angiography and angioplasty explained in simple terms. We've journeyed through the intricacies of these two vital procedures, shedding light on their role in maintaining heart health. Angiography, a diagnostic tool, helps doctors visualize your blood vessels, pinpointing obstructions that might pose threats. On the other hand, angioplasty, a treatment approach, aids in clearing these blockages, restoring normal blood flow. Understanding these procedures is more than mere medical jargon. It's about empowering you with knowledge, enabling you to participate actively in conversations regarding your heart health. Remember, when it comes to your well-being, being informed is being prepared. So let's keep this conversation going. Let's keep exploring the fascinating world of medicine together. Stay heart healthy and keep exploring with This Is Interesting. If you found this video beneficial, share with those who might need it. And of course, don't forget to subscribe for more informative videos.